طلاب السلايدات واضحة هسه؟
هي موجودة السلايدات.
يلا. We start the fourth lecture of acute inflammation, and the objectives of this lecture is the morphologic pattern of acute inflammation. That means what are you seeing by the naked eye examination and light microscopic examination of tissue, which is involved by acute inflammation. This is the morphologic patterns of acute inflammation, which is dependent on the causative agent, the particular tissue which is involved by acute inflammation. All these modify the morphologic pattern of acute inflammation and may suggest the underlying cause from the examination of the inflamed tissue. The morphologic pattern of acute inflammation include the following. First, catarrhal inflammation. Second, serous inflammation. Third, fibrinous inflammation. Fourth, suppurative or purulent inflammation with abscess formation. Fifth, hemorrhagic inflammation. Sixth, pseudomembraneous inflammation. Seventh, gangrenous inflammation. And eighth, ulceration or ulcerative inflammation. There are 8 morphologic patterns of acute inflammation depending on the causative agent and the character of the tissue which is involved by inflammation. We start first with the catarrhal inflammation. It is mild acute inflammation of mucous membrane. We see the morphologic pattern depends on the type of tissue, the severity of inflammation, and the causative agent. So the catarrhal inflammation is the most common type of acute inflammation, and it is mild inflammation of mucous membrane, characterized by excessive mucous fluid secretion, and there is little necrosis or no necrosis or damage of the tissue. Example, catarrhal inflammation is the common cold or coryza, which is very common. There is nasal obstruction and nasal congestion with excessive mucus secretion from the nasal mucosa. So catarrhal inflammation is the most common type of acute inflammation. Okay. This is the pharynx acute pharyngitis. This patient has acute pharyngitis. There is congestion and swelling of the mucosa of the pharynx. With the prominent, you see a prominent vascularity of nasal mucosa. Of the pharyngeal mucosa. And the mucosa is intact. There is no necrosis and no damage. You see this mucosa is intact. It is a mild inflammation of the mucous membrane. Okay. The second type of acute inflammation is serous inflammation. From the name, serous means inflammation of serous membrane. The serous inflammation is acute inflammation of the serous membrane, and it is characterized by clear watery fluid, catarrhal mucus fluid. Serous inflammation, clear watery fluid in the serous cavity, such as dural cavity, peritoneal, pericardial, and synovial cavities, which is called effusion. So what is meant by effusion? Effusion is accumulation of a fluid in the serous cavity. Ascites, what is meant by ascites? It is not an inflammation. Ascites, look to the end of the term. It is not itis, it is es. Ascites means accumulation of fluid in the peritoneal cavity. Whatever the cause, inflammation or malignancy or other cause, the كلمة ascites means accumulation of fluid in the peritoneal cavity, whether due to the acute inflammation or due to the malignant tumors or due to the other causes. Example also on the serous inflammation is accumulation of serous fluid or exudate within the skin blister, which is caused by burn or by viral infections. The serous exudate is watery fluid. It is not turbid fluid, and it is not mucus fluid. Okay? The other example is skin blister, which is caused by burns or viral infections such as chickenpox viral infection. As in chickenpox, there is a formation of skin vesicles, which is followed by a clear fluid. This is example, skin blister due to the burn. This blister followed by serous exudate, which is a clear watery fluid. اوكي اكو سؤال على السيرس انفلاميشن والكاترال انفلاميشن. اكو سؤال. We come to the third type of acute inflammation, fibrinous inflammation. Fibrinous inflammation is severe inflammation of serous membrane. So serous inflammation, it is also an inflammation of the serous membrane. But the serous inflammation is mild inflammation, while fibrinous inflammation is a severe inflammation. So the morphology of acute inflammation depending on the severity of the inflammation, in addition to the causative agent and the character of the tissue. So it is a severe inflammation of the serous membrane with excessive deposition of fibrin in the serous cavity and formation of fibrinous exudates. So you see the differences between the morphologic pattern. Serous inflammation, the same inflammation of the serous membrane, but the severity is different. And the inflammatory exudate is different. In the serous inflammation, watery fluid, while in the fibrinous inflammation is a fibrinous exudate. There is excessive deposition of fibrin. The fluid, which is the plasma, is usually removed by lymphatics into the regional lymph node. You know, serous membrane consists of two layers, parietal layer and visceral layer. Visceral layer attached to the organ, and parietal layer outside. The inner layer, it is visceral, and outer layer is parietal. And there are a few cc of fluid, about 5 mol of fluid between these layers for a 3D movement of these layers on each other حتى تتحرك بسهولة هذه الفيزرال والبرايتال لاير قليل من الفلويد بينها هاي نورمال حتى تسهل حركة الفيزرال والبرايتال لاير on each other حركتها على بعض. بالفايبرينوس inflammation the fluid is removed by the ماجنال inflammatory exudate. It is removed by within the first 2 days, removed by lymphatic vessel to regional lymph node. شنو راح يبقى عندنا؟ راح يبقى عندنا الفايبرين مش وايت. فboth visceral and parietal layers of serous membrane are stacked تلتصق مع بعضها by fibrin meshwork. And when we separated from each other, giving appearance of bread and butter appearance, as in cases of fibrinous pericarditis. تشبه شلون واحد يفرش الزبد على الخبز. So this is a feature of fibrinous inflammation, bread and butter appearance, as we've seen in the fibrinous pericarditis. Usually, the fibrin degraded by a fibrinolysis system and removed by macrophages by phagocytosis, with the clearance of cellular debris resulting in resolution. Resolution يعني الشفاء التام. When the amount of the fibrin is a little amount and the macrophage can phagocytose it. But when there is excessive amount of fibrin, incomplete removal of fibrin, resulting in the organization and fibrous adhesion of the dura or the pericardium. What is meaning of organization? Organization means converting of fibrin into fibrous tissue by proliferation of new blood vessels and fibroblasts. So this is means by organization. Organization means converting and replacement of the excessive fibrin by the fibrous tissue. This fibrous tissue cause fibrous adhesion of the dura and the pericardium and interfere with the function of the lung and the function of the heart. This is the serious effect of fibrinous inflammation. مفهوم؟ أكو سؤال؟ أكو أحد ما فاهم هذا السلايد؟ This is fibrinous pericarditis. On the left, you see this is the heart, and there is excessive fibrin deposition on the surface of the heart. Means this is a visceral layer of the pericardium. Visceral layer of the pericardium, which is attached to the surface of the heart. This is a bread and butter appearance, resembling the spread of the butter on the bread. On the right side, also the heart. And you see, this is a parietal layer. This is a parietal layer. When we try to remove the parietal layer from the visceral layer, you see this is the fibrous adhesion. This is the fibrous adhesion, means this is organization of fibrinous oxidation. Okay, so this is the fibrous adhesion of the parietal and visceral layer, which is interfering with the function of myocardial contraction or the function of the heart. So it should be removed by operation, by process of decortication. Decortication means removal of dura or pericardium in case of organization. I repeat, organization means converting of the fibrin and replacement of the fibrin by fibrous tissue or by fibrosis, which is occurred by proliferation of the blood vessels and fibroblasts, leading to the formation of the fibrous tissue. مفهوم الorganization. It is occur when there is excessive deposition of fibrin, which is incomplete removal by macrophages. Okay. This is the cytological features of a fibrinous exudate. Abundant fibrin in the background. Is appear as a thread or pinkish thread. This is fibrin. The majority of fibrinous exudate consists of fibrin meshwork with scant neutrophil or small numbers of neutrophils. Okay, this is the picture, cytological features of fibrinous exudate. We call it as suppurative inflammation. Suppurative inflammation can occur any type of tissue. Here, the causative agent is determined the type of inflammation, not the type of tissue. The causative agent. The suppurative inflammation or virulent inflammation is characterized by large amounts of virulent exudate, which is pus. Virulent exudate means pus. It is caused by biogenic bacteria, pus-forming bacteria. Bio, this term means pus-genic formation. يعني pus-forming bacteria such as Staph aureus and Streptococcus pyogenes. Examples are this boil or furuncle. Boil or furuncle means abscess of hair follicles. And the term amblyemia means collection of pus in the body cavity or a hollow organ. Amblyemia is a collection of pus in the body cavity, such as peritoneal or pericardium, or in the pleura, like amblyemia of pleura or amblyemia of pericardium, or collection of pus within a hollow organ, as in the gallbladder, which is called amblyemia of gallbladder. When the neck of the gallbladder is obstructed by stone with an acute inflammation of the gallbladder, which is called cholecystitis, and the causative agent is biogenic bacteria, pus-forming bacteria, lead to the accumulation of pus within the cavity of the gallbladder. It has become cyst-like structure filled by pus, which is called amblyemia of gallbladder. فأوكي مفهومة كلمة الامبايمة والابسس of the hair follicle, the boil and the furuncle. Pus. What is mean by pus? Pus is a thick, creamy, viscous, yellowish or greenish fluid, and it is consisting of dead and dying neutrophils, fluid or exudate, bacteria, necrotic tissue or cellular debris. So, the pus is defined as a virulent inflammatory exudate. It is also a type of inflammatory exudate, but it is virulent, rich in neutrophils and cellular debris. This is the cytological feature of pus. You see there is numerous neutrophils, some dying and some dead, because neutrophils are short-lived. This is a large cell. You see, this is large cell is macrophages. Come to the area for phagocytosis to engulf the necrotic debris or the necrotic cells. اوكي، اكو اي سؤال؟ اي استفسار؟ واضح الشرح؟ We come to the abscess. What is mean by abscess? Abscess is defined as a localized collection of pus, has central cavity or the protective necrosis, and is surrounded by a layer of inflamed granulation tissue, which is called biogenic membrane. So as we said previously, abscess is example of the protective necrosis, as you take in the cell degeneration. The types of necrosis, abscess is regarded as a protective necrosis. So it is a localized collection of pus, has a central cavity. This central cavity formed by necrotic tissue or the protective necrosis. And the pus is, an abscess is usually surrounded by a layer of inflamed granulation tissue. Granulation tissue is a tissue of healing, which is called biogenic membrane. What are the outcomes of the abscess? Either burst by itself ينفجر لوحده, or surgical drainage أو جراح هو اللي ينظفه, or healing by fibrosis and scarring. So whenever there is abscess, it should be drained. فالعلاج الابسس هو لازم تنظيف. This is picture shows a very nephric abscess. This is the kidney. There is acute inflammation of the kidney, which is called acute pyelonephritis by biogenic bacteria. With the spread of infection from the kidney to the perinephric fat. This is perinephric fat. You know, the kidney is surrounded by fat, which is called perinephric fat. The spread of infection from the kidney to the perinephric fat with the formation of this localized collection of abscess at the upper wall of the kidney. Upper wall of the kidney, this is a greenish material. You see, this is a greenish material. So this is perinephric abscess, localized collection of pus in the perinephric fat as a complication of acute bacterial infection of the kidney, which is called acute pyelonephritis. Acute pyelonephritis is acute inflammation of the renal pelvis, calyces, and renal tissue. This slide shows suppurative inflammation of the hair follicle, and this is the skin. And there are multiple abscesses are formed within the hair follicle, which is called boil or furuncle. The boil or furuncle is an abscess of hair follicle. This is especially occurs in children in hot weather. So there is infection by Staphylococcus aureus of the hair follicle producing this is small localized abscesses within the hair follicle. This is also abscess formation in the posterior aspect of the shoulder or the axilla, in the posterior aspect of the axilla or in the shoulder, posterior aspect of the shoulder. You see there is a pouring of pus from the opening of abscess. This is pus, yellowish fluid. The pouring of pus from the opening of the abscess. There is formation of abscess and pocket of pus within the soft tissue of the axilla. This is the lung, and there is a suppurative bronchitis as a complication of acute bacterial inflammation of the lung, which is bronchopneumonia, acute inflammation of the lung by bacteria, which is called bronchopneumonia. And the bronchopneumonia leading, without treatment, leading to the suppurative bronchitis. This is abscess formation within the bronchi and the bronchioles, a clear whitish yellowish in color, as a complication of bronchopneumonia. In neglected cases without treatment may progress bronchopneumonia into suppurative bronchitis with multiple abscess formation within the bronchi and bronchiole, causing suppurative inflammation of the lung. This is the histologic features of abscess. We said the abscess is localized collection of pus, but this is abscess. Localized collection of pus has a central cavity of liquefactive necrosis. This is liquefactive necrosis. And this is the wall of the bronchiole. This is the same case as previous slide, the same slide. This is a gross feature of suppurative bronchitis, what we see by naked eye. And this is the microscopic or histologic feature of the same lesion. So you see, this is the wall of the bronchi lined by the, this is epithelium, columnar epithelium. And the lumen, this is the lumen of the bronchus, is filled by abscess. This is a necrotic tissue. And the wall of abscess, the wall is surrounding by an inflamed granulation tissue, which is called the biogenic membrane, consisting from proliferating blood vessels. You see, this is the red area. This is proliferating blood vessels, the red area, because of RBC within the lumen of blood vessels, and fibroblast proliferation. The granulation tissue is a tissue of healing. The healing starts by formation of granulation tissue, then granulation tissue matures to the fibrous tissue. This abscess try to heal, يحاول إنه healing by fibrosis. واضح السلايد؟ ماكو أي جواب ولا بعد، يعني النت ضعيف ولا ماكو أي طلاب ويانا رجاء؟
دكتورة واضح. إي واضح دكتورة.
ما جاي يجاوبون حتى أعرف يعني واضح أو لا. هسه فهمتوا الأبسس ومنين يتكون؟ We come to the fifth type of acute inflammation. It is hemorrhagic inflammation. You see, this child has multiple patch, hemorrhagic patch in the skin. Hemorrhagic patch in the skin of the chest, abdomen, shoulder, in the face, This is due to the inflammation of blood vessels in the skin, which is called vasculitis. Vasculitis, inflammation of small blood vessels in the skin, causing hemorrhage and producing this hemorrhagic batch. This is the morphological pattern of hemorrhagic inflammation. We come to the pseudomembranous inflammation. Pseudomembranous inflammation, it is a very severe and ulcerative. انتبهوا على التعبير. It is very severe ulcerative inflammation of mucous membrane. يساعدنا الميوكس membrane إذا كان mild inflammation نطلق عليه catarrhal inflammation. إذا كان very severe inflammation with ulceration نطلق عليه pseudomembranous inflammation. With excessive necrosis of the surface epithelium such as mucosa of the GIT or any other mucosa in the body. With the formation of pseudomembrane, غشاء كاذب, pseudomembrane, which is consisting of inflammatory exudate, fibrin, neutrophils, RBC, bacteria, and tissue debris. This is the pseudomembrane. It is whitish, dirty membrane. Whitish in color and dirty membrane. Example, pseudomembranous inflammation is diphtheria, which is acute inflammation of the lungs by Corynebacterium, diphtheriae. الخناق. Also, other example, pseudomembranous colitis by Clostridium difficile as a complication of intake of these antibiotics, lincomycin and clindamycin. Some person who take antibiotic, lincomycin and clindamycin, the side effect of this antibiotics is formation of pseudomembranous colitis due to the overgrowth. Lincomycin and clindamycin cause overgrowth of normal bacterial flora, which is Clostridium difficile. Clostridium difficile is normal bacterial flora in the bowel. When we take this antibiotic, cause overgrowth of this Clostridium difficile and become pathogenic, causing pseudomembranous inflammation or pseudomembranous colitis of the colon. The patient develop colicky abdominal pain with diarrhea. When the patient develop abdominal pain and diarrhea with fever, this antibiotic should be stopped. Nowadays, lincomycin and clindamycin are not prescribed to the patient and given only in cases when there is allergic to other antibiotics. The patient has allergy to the penicillin or amoxicillin or other antibiotic, and there is no other choice, they can give lincomycin and clindamycin. Because lincomycin and clindamycin has a side effect, which is pseudomembranous colitis. You see this on the right side, this picture of larynx, and this patient has diphtheria, and the mucosa of the larynx is covered by whitish, dirty membrane. This is called suffocation and asphyxia, especially in children. On the left side, this is a colon, and the mucosa of the colon is covered by pseudomembrane. causing pseudomembranous colitis. You know, it says pseudomembranous colitis occurs as a side effect of intake of antibiotics, clindamycin and lincomycin, which cause overgrowth of normal bacterial flora, such as Clostridium difficile. This flora become pathogenic and cause inflammation of the mucosa of the colon with the producing of pseudomembrane. Second, gangrenous inflammation, which is the more serious acute inflammation. Gangrenous inflammation. It is the more serious, dangerous inflammation. Gangrene means tissue necrosis with putrefaction. موت النسيج مع تعفن. أبسط تعريف للجانجرين. أبسط تعريف للجانجرين هو موت النسيج مع تعفن. فالجانجرين is tissue necrosis with putrefaction due to the invasion and digestion of the tissue by suppurative bacteria, like putrefaction of meat in hot weather. تشبه تعفن اللحم بالجو الحار. So there is a black discoloration of the tissue and bad odor or foul smell of the tissue with black discoloration. Example, on the gangrenous inflammation, you will take gangrene or gangrenous inflammation in more details in the lectures of infection. The example on gangrenous is diabetic foot. What is meant by diabetic foot? The patient with diabetes, long-term diabetes and uncontrolled diabetes will develop atherosclerosis. Atherosclerosis of the blood vessels, especially of the lower leg, with the narrowing of the lumen of the blood vessels, causing ischemia of the lower leg. In addition, diabetic patient also has peripheral neuropathy with loss of sensation in the foot and lower leg. So any trauma to the foot or lower leg will lead to the tissue necrosis with putrefaction by suppurative bacteria, which is usually present in the soil. Other example of gangrenous inflammation is gangrenous bowel, as occur in the volvulus. This example of gangrenous inflammation, this finger with gangrene, you see black discoloration at the tip of the finger with the spread of inflammation. This is the red area, means a spread of the gangrene more proximal in the tissue. This is also diabetic foot with gangrene of the toes, black discoloration in the toes. This is also diabetic foot with a black discoloration of the toes and foul smell discharge with spread of gangrene proximal in the tissue. So the usual or ordinary treatment of the gangrene is amputation of the gangrenous part at the level of the healthy normal tissue to prevent the spread of the gangrene. This is gangrenous bowel You see, valvulus. Valvulus means a twisting or torsion of the bowel on itself, causing ligation of the blood vessels at the mesentery. Ligation of the blood vessel, which is supply the bowel at the root of the mesentery, and in addition, presence of the bacterial flora in the lumen of the bowel produce gangrenous inflammation. So this is, you see, there is distended of the small bowel and black discoloration due to the gangrenous inflammation. The valvulus were torsion or twisted of the bowel on itself with the ligation of the blood vessels at the root of the mesentery, causing cutting of blood supply to the bowel. In addition, presence of the bacterial flora in the lumen, leading to the gangrenous inflammation because of the tissue necrosis with putrefaction by the bacteria. The last ulcer is epithelium, such as surface epithelium, such as skin or any mucosa in the body. Example, GIT mucosa or genitourinary associated with acute and chronic inflammation. That means there are acute ulcer and chronic inflammation. So when there is acute or chronic inflammation, induced necrosis of the cell with sloughing and shedding of the inflamed necrotic tissue or surface epithelium or mucosa of the involved organ, leading to formation of ulcer. Example, gastric or peptic ulcer or duodenal ulcer, and ulcerative colitis, which is a chronic inflammatory bowel disease. This is the morphological pattern of duodenal ulcer. This is duodenum with a local defect in the mucosa. You see, this is a local defect in the mucosa of the duodenum. This is a gross feature, and this is the lower picture is the histologic feature. You see the ulcer is a defect in the local defect in the mucosa or loss of continuity of the mucosa, loss of the continuity or defect in the mucosa. On both sides, this is a normal mucosa on both sides, and this is ulcer, and the base of the ulcer is covered by an inflammatory exudate. This is gastric ulcer. This is the stomach. This is the gross feature of gastric ulcer. This is a defect in the wall of the stomach or in the mucosa of the stomach. This is also ulcerative inflammation. This is ulcer in the skin, and the base of the ulcer is covered by inflammatory exudate. This is also ulcer in the gluteal region as a complication of abscess formation. Abscess in the gluteal region with the sloughing of necrotic skin, leaving large ulcer in the gluteal area with an inflammatory exudate covering the base. Okay, any question? أي سؤال؟ Thank you very much for your listening. أي سؤال؟ أي سلايد ما فاهمينه؟ ها كلها بعدكم سؤال؟ واضح المحاضرة؟
نعم دكتور، شكرا.